Good question, Bex. So it sounds like something like diarrhea. So diarrhea is when you're passing loose or watery stools more often than usual. It is most commonly caused by an infection, like a virus, and often gets better on its own in a few days. It is really very common. We're talking about most adults having one or two episodes per year, so you're not on your own. The most important thing when you have diarrhea is to stay hydrated. Now, that doesn't mean you have to drink just gallons of water. Some people will drink things like oral rehydration salts, which are these sachets that kind of make your water quite salty or sweet in order to help your body absorb more of the water. But having diluted fruit juice or clear soups are equally good at getting your body more hydrated. Do steer clear of alcohol and caffeine, as well as some fizzy drinks. These contain caffeine, which will actually make you pass more water. So, when you're trying to conserve that water in your body, the last thing you want to do is increase passing more water as well. People sometimes ask me, well, what can I eat whilst I've got this dicky tummy? Well, what I normally describe it is as having a bland diet, so or a beige diet, as it were. You want those stodgy foods, toast, rice, bananas. Bananas have a lot of potassium in, so that'll help restore some of those salts that you might be losing through the diarrhea. But again, avoid quite fatty or spicy foods as well as dairy rich foods because those can upset the tummy. Um, in addition, I advise people to avoid high fiber. So, usually, all those good greens and those salads that we would normally have when we're healthy are really, really good, but actually can make things pass quicker through our digestive tract. And the last thing we want to do is speed up what's already a really quick process already. Sometimes people will talk to me and say, well, what medication can I take? So we've spoken a little bit about the oral rehydration sachets. You can buy those over the counter. They're an acquired taste, so a lot of people will not enjoy those, especially children. But we also know of some anti-diarrhea medication. One of them is called loperamide that stops or slows down diarrhea. Now, there's a mixed response to that, in that although it will slow things down, if you have a bug, the diarrhea is your body's way of getting rid of it. So if you are now slowing it down, that bug might stay around for longer. So what I turn around to people and say is try and avoid taking that because what we want is for your body to get rid of that infection on its own. It's important to remember that you don't want to give your diarrhea to anyone else. So do make sure you wash your hands with soap and water, clean the toilet seats, flush handles, and door handles well, because we don't want those germs to be passed on. And do stay at home for 48 hours after the last episode to avoid giving it to anyone else around you. Now, as we said, diarrhea should, if it's caused by a germ, usually resolve within 7 days. So if you are still struggling with symptoms and it's not getting any better after 7 days, do let the doctor's surgery know. What we will probably need to do is assess you. We might do some tests to look and see if there is a germ that's causing a problem. So sending a stool sample, for example, or we might sometimes do some blood tests to make sure that you're not too dehydrated. Um, but if diarrhea is going on for a lot longer than that, we might do some other further tests to make sure there's nothing wrong with the gut. So if you've got a diarrhea that's lasting more than 7 days, there's blood in your stool, or you have severe tummy pain, if you're becoming quite dehydrated, so you've got a dry mouth, you're not passing urine, or if you're very elderly or very young, pregnant, or have a weakened immune system, we want to hear from you.